Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
Living it up.
Yay. I would think something was abnormal if you didn't say that, so I'm thrilled to hear it. And we want all our listeners and future callers in moments, I hope, to live it up as well. This is a show about musculoskeletal pain, and you can call all hour long to speak to Dr. Darrow at 1-866-870-5752. That's 866-870-5752. And we're talking about muscle pain, joint pain, tendon pain, ligament pain, back pain, neck pain, knee and hip pain, arthritis pain, and anything that is supporting the body, joints, aches, basically orthopedic pain. You want to give a call right here, right now, and talk to Dr. Darrow about your pain. He might just have a solution for you. And that number again is 866-870-5752. And I would love for you to go look at the website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and also see him performing the treatments on video. We are here Saturdays at 10 a.m. and again at 1 p.m. And when you call the program, here's the best part. You get a free book, Dr. Darrow's latest. It is called Stem Cell and Platelet Therapy. Regenerate, Don't Operate is the subtitle. And there's over 250 studies in this book. So doctors can read it too. So that's all I got. How about you?
Well, everybody seems to like research today. There's a big prize that's put on research, and we have 20 researchers in our office. They're either students in college or postgrads on the way to medical school. So we're doing putting out a lot of information, publishing quite a bit. Our director of research is Brent Shaw, who's on his way to medical school pretty soon, and he runs the operation. So every one of you that comes in are really in a research study, and that helps everyone learn about how these regenerative procedures work. So if you want a copy of the book, just give us a call at the office at 800-300-9300, or go to the website at www.lastemcells.com, where you can email me, and we will send you immediately an ebook, and then if you like, we can actually mail the hard copy to you. So yes, it has, I just looked, it had 264 studies in this book already on how regenerative medicine works and how surgery doesn't work. And this is not a statement against the surgeons, because we need surgeons. We just don't need them to be doing surgeries on the joints, ligaments, and tendons when they're not needed. It's all too often I have people coming in ready for a quote knee replacement, shoulder replacement, hip replacement, all kinds of other things that don't really need to be done. So if we can help regenerate your tissue using platelets from your blood or stem cells, we can get stem cells either from your bone marrow or from cord blood. That's the way we do it. Get your choice. Some people mix them together, and it all depends what you want. We talk about it and figure out what you think and we think is going to work best for you. So I'd like to go immediately to a question that just came in on shoulder pain. And the first three that came in are on shoulders, hips, and knees, but we do treat the whole body, necks and backs and arthritis and toes and you name it. So fingers, we get a lot of people with finger arthritis that we treat. And let me see what this question says. Actually, this one's short. It just says shoulder pain. It doesn't really
that's
have much.
funny. No description, huh?
No description, but shoulder pain's real common. And when I emailed this person back and said, what's going on? What did it come from? And they said, thank you for the quick reply. It's been chronic for 6 months and limiting range of motion, probably induced by sports, rock climbing in parenthesis, no treatment applied yet. So the good news is, if this person hasn't run to a doctor, they're not too bad, but it's irritating. And usually what that is in the shoulders is the rotator cuff, and that's a series of 4 tendons that hold the humerus or the arm bone in place. And they're muscles that contract, that pull the tendons and then pull the bone in different positions. So when I treat a shoulder, depending on the pathology, I'm either going to use platelets from your blood if it's not very bad, maybe just a little tendonitis, or if there's a tear in the rotator cuff, I'm probably going to add to the platelets, I'll add stem cells. And that can be either, as I mentioned, your own bone marrow if you like that, or we can use cord blood stem cells. And both very simple, easy treatments to do. Most people are opting out of the bone marrow now that we have cord blood that we can just buy and mix in, and just takes a couple seconds without any drilling. But some people are still diehards about wanting their own cells, and I did a couple of bone marrows yesterday, and I think averaging about 100 cord bloods a month now, and maybe only about, I'm trying to think, maybe about 4 bone marrows a week, so maybe about 15 or 20 of those a month. So the percentages have changed. It used to just be all bone marrow, and I've done mega thousands of those and several hundred of the cord blood. The study that we're doing in the office now compares both of them, and we're finding out the statistics show that whether you use cord blood or whether you use bone marrow, the results are exactly the same.
Oh, that's
So
interesting.
it is. It's amazing. So it's good for people that don't want to go through the procedure of the bone marrow. And it's a lot of fun. That's all I can tell you. It's a lot of fun watching people heal. So what are the common pathologies in a shoulder? Well, tendonitis is the most common. Bursitis is another one. There's a great big bursa under the acromion, which is right at the top part of the shoulder that comes off of the scapula. And underneath is a bursa, which is a fluid-filled sac that cushions the tendons from the bone. And that's a very common thing that we see, along with tendonitis of the rotator cuff, being either the infraspinatus or the supraspinatus is most common. That's right in the area that allows us to lift our arm up. And then the teres minor and the infraspinatus. I think I have those. Anyway, so there's 4 tendons as part of the rotator cuff. And when I inject a shoulder, I'm going to hit all of the tendons in multiple places. I'm going to hit the subdeltoid bursa, and I'm going to hit the joint. Joint has to be injected by way of an ultrasound imaging. If you don't use imaging, you're going to miss that joint. You might get it into the bursa, which is also good, but if you're not hitting the joint, you're missing a substantial part of a pain generator in most cases. So if you've got arthritis in the shoulder, it's generally of the glenohumeral joint, which is where the humerus attaches to the scapula, or it can be the AC joint, the acromioclavicular joint. And usually the pain we find is not from the AC joint, although a lot of people have that arthritis. It's not often a pain generator. So don't have someone treat you based on your MRI or X-ray, because it may show some pathology, but it may not be the pain generator. Arthritis doesn't equal pain generator. A lot of people have arthritis and have no pain. How do we do that? How do we know that? Because we do studies, and we check people that have no pain, and we do MRIs and X-rays, and we find out that they have arthritis or rotator cuff tears. They still have no pain. What does that tell us? It tells us that we can't trust the imaging to decide where pain is coming from. We have to use our hands, do an examination, and move the person around to find the pain generator. Then we can inject the pain generator and heal them up. What do you think?
I think it's a great idea, and I think it's a much more practical plan than rolling into an elective surgery is the bottom line.
Well, the problem, the reason surgeries fail is because they're being done typically on places that don't need them. So, the surgeons, unfortunately, very often don't even examine the body. They slap an MRI up and show the patient where the problem is, and then they operate. And most of the people that come in that I see that have had a failed surgery, which is common, I get people every day with a failed surgery. And I asked, did the surgeon touch your body or examine you? They go, no, why should they? They showed me the MRI and showed me the problem. And that's not the problem. The problem is where the problem is, not where you think it is based on looking at an image. The image can be accurate, but it may not be accurate. So be very careful that you don't have an operation based on an image and that someone actually moves you around. I get people every single day ready for a knee replacement. That's very common. And I examine their knee, I start laughing, and I go, why would you get a knee replacement when you've got a great knee? And they said, doctor, did you look at my MRI? And I go, yes, I did. It looks bad. And they go, well, then let's operate. And I go, it looks bad, but your knee is good. They don't get that, but that's the way it is. And then we do a few injections and they get better. So why not grow the tissue back? That's simple. We can grow cartilage, we can grow collagen, and we can heal up these tears. We can heal up where cartilage is worn out and keep people from getting surgeries that can fail. Who wants general anesthesia? People can die from that. I've seen it right on the table in front of me.
That's scary.
So actually, it is scary. And I saw a woman who had a heart attack because of her general anesthesia. So stay away from invasive things if you can. The nice thing about regenerative medicine using your platelets or your stem cells is it's easy. It's just an injection. You don't go to sleep. You get up off the table and you can go back to work or do what you need to do.
And I would like to just support what you're saying by mentioning when you treated me years ago and I had an MRI, so I brought it to you. My MRI looks terrible, but we only focused on where I was actually having the pain, which is in the neck area, and I don't have any pain. It doesn't matter what my MRI looks like. The rest of me just feels just fine.
How long did it take your neck to heal when we injected you?
A week.
Yeah.
After months of pain.
Yeah. Necks heal very quickly. I don't know why. But it's usually 1 to 3 treatments with that.
But may I also mention that I followed your I followed your directions. I didn't work out. I rested. And I did everything that you said I had to do to support the healing. So that's an important element as well.
So you're one of the few that didn't cheat on me.
I did not cheat on you. And if you have pain right now, give us a call, please, at 866-870-5752, because you never know. This could be the day that you get out of pain, because remember the name of the show, Living Pain-Free, and Dr. Marc Darrow is very happy to speak to callers. Last Saturday, I want to mention that we had 6 to 8 callers in the last 10 minutes of the program, so a number of you missed out. So please call early in the program. I know you're listening and you're focusing, and we're always learning when you speak, Dr. Darrow. But the thing is, don't wait. Just call. Because when you call, you're speaking for other people in your type of pain also. So we're all going to learn something. 866-870-5752, 866-870-5752. And remember to check out the website at www.lastemcells.com. That's lastemcells.com.
I'd also like to just give out my office phone number right now for those of you that want to call in to get an insurance verification, because we can check out immediately and see if we take your insurance. We do take Medicare and Cigna, Aetna, Blue Cross, Blue Shield, and United Healthcare. And a lot of people don't have insurance, and we can help them get something called Care Credit, which is a credit card for medical procedures with, I think it's no interest for the first year, but then you have to be sure you pay it off because they raise up the interest rates. I want to go to another question here. This is about knees. And that person says, I'm 64 years old with two knees that are close to being bone on bone. Let me deal with that first, because this is a long email he sent. Bone on bone means nothing. I hear it all day. The doctor said I have bone on bone, and then I examine him and I go, you have bone on bone? I don't get it. You got great knees. They move well. They're not clicking. They're not grinding. They're not loose. There's no problem with them. You may have some cartilage worn down, but you can wear down the rubber on a tire and it's still a great tire until it blows out. And yeah, if a knee blows out, that's a different story. You might need surgery, but please don't, just because there's some wear and tear, start thinking about getting surgery on it when it's not needed. If you get a knee replacement, it's not going to last that long if you're active. And then what do? The bone is worn out after a few years, and you've got to put a bigger prosthesis in there. Where is it going to go? The bone can crack. I've had that happen in some patients. I've seen it. And there was one terrible case of a woman who had a hip replacement, but it'd be the same in the knee, and the replacement wore out. And then we tried to put in another prosthesis, which has to be bigger, and it cracked the bone. And we had to remove the entire femur, amputate it, and we carved a cadaver bone to fit. And I wasn't around later to see what happened, but the chances of that working were very, very slim.
That's a lot.
So be careful.
Yeah, be careful.
So again, this person, you want to say something? I hear you breathing.
Well, I just want to let you know we have Joe on hold.
Okay.
But finish what you were saying.
Let me. Well, I'll get to it if we get a little break here, but I want to go to Joe so he doesn't have to.
All
wait.
righty, Joe.
Joe, it's Dr. Marc Darrow, and you have knee pain.
Yes, good morning.
Tell me about it. How long has it been painful?
A long time, actually. Probably
How old are you?
71.
Okay. And give me an approximate. 5 years, 10 years, 50 years?
Probably 3 years.
Okay. And how did it occur?
Well, I'm a former, I like to think of myself as a current runner, but I think I'm more former now.
Right.
And I think it's just over a period of time, I think it's just an overuse type injury. But, the knee, they're always sore, but now they seem to kind of have developed, well, the right knee in particular has kind of developed a kind of a little hitch kind of thing and a snap, and it's accompanied by a kind of a sharp pain when that occurs.
Okay. So typically what that is, it's not always this, but it typically is when your patella, that's the round bone in front of the knee, loosens up and comes out of the track in the femur. Femur is the thigh bone. And that track is called the trochlear groove. And the back of the cartilage of the patella slides back and forth when you bend your knee. If you're a runner, that track wears down and the cartilage behind the patella wears down, and you end up with a tracking problem, which I call patellofemoral syndrome. You can look that up. And it typically is very, very easy to fix using your bone marrow or your platelets plus cord blood stem cells. Usually takes about 3 treatments to heal that up.
Oh, okay.
It could be the actual femur rubbing on the tibia, but I doubt that. You'd be pretty miserable if that were the case.
Well, again, the pain is, I don't know if I've, accommodated to the pain, these past couple of years, but it's not a severe pain, but I just can't run anymore is what my real issue. I mean, my ambition is to meet you and your dogs up in the hills and, run past you. So.
Well, my huskies would love if you did that. They just love to run. And what's interesting? My daughter Jensen has a 2.5-year-old mini pincher Chihuahua mix.
Oh my!
And it's only 13. She's only 13 pounds, and she can sprint like you can't believe. Sometimes I run all three of the dogs together, and that little one gets her ears back and just takes off.
Yeah, the dogs are just wonderful. I mean, they just bring so much, to the table. I mean, they just enrich your life.
There's nothing like a pet.
Yeah.
I mean, we have a lot of people who come in the office who are cat lovers too.
Well,
and they talk about the cats just like I feel about my dogs.
Yeah, I have a small...
They're pure love.
Yeah. So, okay, so I mean, you're kind of encouraged that this is not an unusual kind of esoteric...
No, it's so common.
Okay.
It's so common with runners. Yeah, if it weren't the click, I would be thinking more maybe the patellar tendon, which is part of a runner's knee, or the quad tendon, which is more of a jumper's knee. But yeah, there's all these things that can add up over the years. And at 71, it's like 71,000 miles on a tire. It's starting to wear down.
Yeah.
You still got a lot of good life left in you and a lot of good running left in you, but it's time to do some maintenance. So, if you want to come in, the phone number is 800-300-9300. I can take a quick look inside with my ultrasound and actually see what's going on.
Right.
See if you might have an effusion or some fluid in there, and see which way to go with it. But it sounds like you're in good shape. I think at the beginning of a long running career, if you're willing to do some prophylaxis.
Well, absolutely. Because I just want to, an old, quarter miler. I want to get back to that kind of lifestyle again.
Well, I think you can. Your knees don't sound bad to me at all. I think you just need a little maintenance. And, the problem is most people don't want to do the maintenance. We're all lazy. And we wait till it's too late. We wait till it's, so far gone and we're miserable. And then it's really difficult to regrow enough tissue. It's possible, but you may not be able to run the rest of your life if you wait. And I'm not trying to hustle you in the office.
I appreciate your candor.
Yeah, I got enough business. I'm busy all day, every day. People laugh when I tell them. In 2017, I took off 2 days from work. That's it.
Wow.
I'm busy, and I like doing what I do. And I feel like I have a mission of healing people. So I love it. I love it. I use it on myself. I inject myself whenever I injure myself. Joe, believe it or not, I've injected my own knees. I've used the cord blood stem cells and platelets on my knees. And I'm still up and at 'em. I'm pain-free today. After the show, I'm going to go out and take a golf lesson. And where I go, it's very hilly. It's called Mountain Gate. You ever heard of that, behind the Getty Museum?
Yeah, of course. Well, I'm
just
in West
walking
Burlington.
around there.
Yeah, I'm familiar with the area.
Okay, cool. All right. Well, God bless you, and there's good hope healing up your knees. And I appreciate your call.
Well, thank you. This is very
and
encouraging.
Keep at it. Don't give up. Don't give up to that idea that you're 71.
Oh, no.
Because you don't need to be 71.
Well, unfortunately, I can't turn back the clock, but I just want to be in good health.
Well, that's the point. You can actually turn back the clock by regenerating the tissue. You can regrow it. It would be like saying I've got a 71,000-mile car and the tires are worn down, I better throw the car out.
No, of course not.
No, you just get new tires.
Yeah, exactly.
Yeah. You're in good shape.
All right, well.
I don't have any fear of you losing your run.
Okay. Like I said, my ambition is to, meet you in the hills.
Awesome.
Okay. Well, come on in. The phone number at the office is 800-300-9300,
All right, I'll give you guys a call next week.
800-300-9300, and I'm looking forward to seeing you. You can also go to the website to watch me do some injections of knees. It's so simple and quick, and that's at www.lastemcells.com, lastemcells.com. And if you want a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, you just call me up or email me from the website, and I'll shoot you out a hard copy, or I can instantaneously send you an ebook.
Okay. All right. It sounds great. At any rate, okay, I'll give you guys a call the first part of the week. Thank you.
All right. God
Thank
bless
you,
you, my
Joe.
friend. It's good
Appreciate
hope
your
for you.
time.
Thank you so much. Well, that music means it's time for our little break here on Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and I would love for you to grab a pen or a pencil, write down this important information about to come your way, and we'll be right back.